Hi guys. Right. This is going to be a video about hamsters with teeth problems, just to give you a guide and a few tips on how to deal with it, because this is twice for me now, so I'm getting pretty experienced. So yes, I'm going to start off. So I'm going to do it in two segments and then put it all together. And so if you've got a toothless hamster, or you've got an hamster that has teeth problems and that has to have them trimmed every couple of weeks, and you need to give them extra food because they're struggling to eat the muesli, this is what you need to do. What you need: syringe, water and a spoon. The actual mix you're using, whether it's critical care or mushed up grinded nuggets or muesli, whatever you're grinding up. Now this is just for the one. This is just if you're grinding up the food. Obviously, if you just dissolving the, not dissolving, what's it called? Soaking the food in water and then just giving it to your hamster. That's a total different thing. This is if you have to syringe feed the food. So you grind down to a powder, mix it with some hot or warm water, let it cool. So you need the syringe. If they're on any medication, she's on Metacam, you need that as well. Weighing scales, bowl, tissue, a nice cotton pad just to wipe off any access on the mouth in pores, and that's what you need. And then I'm going to grind down the actual food in a bit, and so I'll show you how that works. So it'll be quite noisy because I've got my blender there, but yeah, so that's that. Right, just hold on to it, guys. Right, guys, and Attie's in here because she's due to get everything done. Hello, sweetheart. Hello, my little star. I know they're really bothering you, aren't they, sweetheart? Yeah. Right. She only had them done last week, and they're curving again. It's unbelievable. So anyway, I rang up the vets this morning because I was. He's been worrying me sick about the operation, and because I've been looking into it, and I had a discussion with them because I was really worried, and they suggested that if I really feel that worried, because they admit it is a very invasive operation, and the vet is not an exotic vet, so they said, well, why not cancel the operation, and then make an appointment with Claire, the exotic vet, and see what she says, and see if and if she decides to do the operation, at least you know you've got an exotic vet doing it, because it's not just the risk of the anaesthetic, but there's also risk of blood loss, because obviously they're yanking out the teeth, and then that could cause vestibular disease and things like that. And I'd hate to see her go down the route of caspidid spinning. So I decided to cancel the operation, just because it's too much of a risk, especially with the blood loss, because they have so little blood, and any loss can be dangerous. So she's booked in, still Monday, but she's booked in with Claire this time. Claire's going to assess her again. No, she hasn't. Actually, she's not assessed her. Sorry about that. I've seen so many vets, it's confusing. So she's going to assess her. She's taking over Attie's care and treatment, and we're going to discuss what needs doing. But she might just recommend just trimming them every 2 weeks, or just book an appointment every 2 weeks with her, and then just providing a way it stays stable. So what I'm going to do is I'm going to give her a bunny dream mix, because she seems to like that, but that's not going to keep her teeth down, and they can't keep down anyway because she's damaged them. We don't know if the bottom ones are going to grow back. They're not as bad as Casper's was, because obviously Casper's were cut right down to the bone by that vet, and but hers, the roots aren't damaged or anything, so hers will probably grow back anyway. So it might not be a permanent thing, but yet it might be a permanent thing every 2 weeks. We don't know yet. We just got to see what happens. And so that's what I'm doing. I'm going to see what Claire says, what she recommends, what she can do. Going to, if it means taking her every 2 weeks to get them burned, as the vet calls it, then so be it. She will have to get used to it because it's for her own good and it's to save her life, obviously. And if I've got to keep monitoring her weight, and obviously on top of her muesli, the bunny dream, because they're so tiny seeds, she can eat them. And I'm going to top it up with some mushed up food. I'm going to, like I said, I'm going to grind her food into like baby powder, baby food consistency. So I'm going to do that, mix it with water, and then syringe feed that once a day. Going to give her some baby food, things like that, a bit of boiled egg. So anything that's like that. Also, she's got whimsies in there, and she's still got a wood chews, just in case when each time she has them trimmed, that she might be tempted to chew on it again. But so I think we've got that plan drawn up for her. But I'll let you know more once I've seen Claire, because she's the expert. And we'll just have a look at the little girl before I get started. While I'm waiting for that to cool. Hello. Oh, I know, sweetheart. I know, darling. Shall we see what you wear today? This is shocking.
Zero.
Come on, darling. I know. Oh, you squeak galore. You squeak galore.
It is 39 grams.
Oh, Hattie. Oh, my sweet baby girl. Hello. Oh, yeah. Gonna get your little nails trimmed in a bit. Hello. Oh, that's positive. Have you got anything in your pouch though? Let's have a little gentle feel. No. So that's good. I'm quite happy. So it works. Syringe feeding her. So you're dropping the ball everywhere. Right, so I'll just give her a little minute while I've got to show you something else. Now for the mix, which I'm going to show you in a bit. So I'll do that second segment. So I'm going to close this now, segment 1, and then I'm going to go on to segment 2 and show you. I'm going to grind up that food to a powder. I think I've done something like this a couple of years ago, but that's outdated now. So yeah, catch you in a mo. Right, guys, to make your own mixed hamster slush or slurry, you need your chosen nuggets, and you can also add some mealworms because they'll grind up to a powder nicely. And then when you're ready to mix with water, which I won't be doing today, you can then add whatever you want, a bit of peanut butter, but it must be pure peanut butter, not like anything like some pat or anything like that, what's got additives in. It's just got to be pure nuts. And or you can get a couple of your own peanuts and just grind them up with it. So we'll go and get everything ready and I'll show you what to do. Right, guys, there's 50 grams in there because you don't have to do an whole lot. So now I'll get, let's see.
It is 47 grams.
Oh, shut up. Oh, 47 grams, sorry, guys. And then we'll just put a little spoonful of mealworms in.
It is 48 grams.
That's about 1 gram of mealworms then. Now I'll just go and get something else. Right, guys, so I've put a couple of peanuts in there as well, so they'll all be grinded up. So I'll go and get my blender, because you need a blender.
50 grams.
Any blender will do, but I use the Bamix. So I'll just go and get that switched on. Right, guys, now you can virtually put whatever you want in, really. That can be grinded down. I suppose you could even put muesli in there as well if you wanted, which I'll probably try one day. I have tried it in the past. Right, so here we go, guys. So I'm gonna put this on. So this will be a bit noisy. If it gets too noisy, I'll just do it without filming. I'll just hold on. Let's get this switched on proper. Just hold on a minute, guys. I'll be back in a tick. Right, guys, here we go. Now, excuse the noise. Not usually wobbly like that. Ah, there we go. Right. Now you need it to be very, very fine if you want to shrinch feed. I'll just check that. Right, guys, and there we have it. A nice fine powder, which you can mix with hot water. And jobs are good. And now you can put that in a tub. And then you just scoop out a couple of spoons each day. And shrinch feed it to them. Or if they'll eat it with, in a bowl or whatever off a spoon, that's even better. So yes, I'll just wrap up here for a minute. I'll be back in a minute. Right, guys, so there you go. Then all you do, you just scoop a bit out each day. This is to help keep the weight up. And it may look a bit grainy, but it isn't. It's completely fine. It's just the way it's looking at the moment. But yes, you melt that in some a couple of spoons with some hot water. And I think I'll try that now, actually. So just hold on a minute, guys. So I'll just go and get a little tub. Hold on. Right, guys. Now, as she'd already had critical care this morning, she can have this tonight. And I've just given her a bit of baby porridge, which she's absolutely loved. So that's that. That ready? Yes, that's ready. So I'll just put that to one side. So I'm going to mix this with some hot water now, and I'll show you that. Right, guys. So I'm going to give this a good mix, and I'll show you the result in a minute, and then I'll wrap up. Right, guys. Now, it's always best to put less water in at first, and you just put a little bit in if you want to. Now, this is a consistency where if you want them to eat it straight out of a bowl. But if you want to make it a bit more runnier so you can shrinch feed it, you just add another little, just another little spoonful. So put it in. I don't know if anyone else has done this, but it doesn't have smell when you melt down nuggets. Oh. So I'm going to leave this to cool, then I'll give her this tonight. And I'll add some more water to it tonight, because by tonight this will be all set. It'll go a bit harder, obviously, just like critical care does. But when that's cold, I'll put that in the fridge. And there you go, guys. All that's got in is our nuggets. I'm going to give it another mash in a minute to make it smooth. Some mealworms and some peanuts. And you can put whatever you want. You could even put little bits of baby food in. You could put porridge in. And things like that. You can, or you can do all sorts. And yeah, now if you want to see anything else regarding this, any more tips, just let me know. If you want me to do a video on shrinch feeding, I know I've done that in the past, but my technique is a little bit different now. So so if you want me to do a video on our shrinch feed at his critical care and also this when I start giving it her, then let me know, because like I said, my technique's changed since I last syringe fed an hamster. So yes, and I could go through all that with you actually, syringe feeding an hamster, the do's and don'ts, because you have to be very careful obviously when you're syringe feeding. So yeah, right guys, I hope this has been helpful, and like I say, if there's anything else you can think of regarding this area, this topic, then please, you know the dig, just let me know, and I'll see what I can do. Bye.